Welcome to the summary of the board meeting, the latest board meeting, which took place on the 6th of November. I'm Jonathan Higman, I'm the Chief Executive here at Yeovil Hospital. As with every board meeting, we started with a patient story, and this month's story was particularly moving, and it highlighted the impact that the Home First service is having on enabling patients to return home following a life-changing event. We had a particular story about a patient and his wife and the impact that that service has had on them. It was followed by a highlight video which focused on the complex care service, and I think together the two things really brought home how the new care models based in the community are having a really positive impact on patients, on reducing admissions here to the hospital and reducing length of stay. And this was also picked up in our executive report, which amongst other things highlighted the I Care About Enabling Week, which took place in October, and aimed to showcase the impact that all of our allied health professionals have right across the hospital. We also noted a number of awards that Yeovil Hospital has received recently. I've spoken previously about the Nursing Times Award that we received for our work around overseas recruitment, and also the Emergency Ambulatory Care Service have recently received a highly commended award for the work that they've done on thrombosis management. On the day of the award ceremony, actually a group of us attended the Health Service Journal Awards in London, where we were up for two awards, one around overseas recruitment and also some of the work that we've been doing around health and well-being. It was a brilliant evening, and although we didn't win, it was a fantastic achievement just to be shortlisted with up to 50 nominations for each award. And this week we're also up for two National Retention Awards, one focusing on staff retention across the hospital and the other again on health and well-being, and they're NHS England and Improvement Awards, so we await the outcome of that. Our overseas recruitment work continues to go from strength to strength. We're now recruiting for 13 other hospitals across the southwest, and have had a visit in the last 2 weeks from the director of the workforce director from NHS England and NHS Improvement, and also from Health Education England, who are keen to support us as to develop that initiative as part of a regional solution. We also received an operational update, which I think noted that we continue to see record number of attendances to our emergency department, and combined in the middle of October with a number of norovirus outbreaks, that made for an incredibly challenging operational period. Despite this, our ED performance, whilst it's dropped, still maintains relatively high performance. We're still the second highest performing hospital in the country. We also noted the work that's underway with St Margaret's to assess and limit any impact on YDH of the hospice beds closure. The board then also had an update on where we are with flu vaccinations. At the current time, our vaccination rate is at 48%, so we've still got some work to do on that front. There's been some issues, particularly with availability of vaccines for the over 65s, and we are planning to have a renewed focus on this, particularly during the week of the 25th of November, where on the 25th of November we'll be instigating a peer vaccination day. So please, if you haven't had your flu vaccine, this is about keeping colleagues and patients safe during the winter. Please take every opportunity to do that. The board then received the plan for the coming winter from Simon Setti, our Chief Operating Officer, which talked about resilience and risk as we go into what is traditionally the most busy time of the year. The meeting this month focused very much on operations, and we looked at our balanced scorecard. Pleasing to note the progress that we made across all indicators, particularly those around safety and patient experience and workforce. Our challenges at the moment, operationally, our challenges are around our diagnostic service, where we've got some capacity issues in both echocardiography and endoscopy, and also in our cancer standards. So although we're achieving the 62-day standard from diagnosis, from referral to treatment, which is really positive, we have some challenges around our 2-week waits, particularly related to the volume of referrals and some capacity issues in dermatology during September. From a money perspective, whilst we're on track at month 6, we have some significant pressures coming in the second half of the year, particularly related to the potential cost of escalation over the winter period. And the risk at the moment is valued at about anything up to £3 million. So we need to continue to work hard to look to drive efficiency through every element of the hospital, and to have a real focus on containing cost in the second half of the year, albeit within the context of that incredibly challenging operational perspective. And we finished the meeting with a number of items which were to note. You can see these on the Trust website. They're papers which have gone through in detail by a number of our committees, focusing on our learning from deaths. Again, we have some work to do there to look at the number of death reviews that we undertake and making sure that we continue to increase the proportion of all of our deaths which have a formal structured review. Our Freedom to Speak Up Guardian report, and feedback from our patients, our patient feedback report. So again, if you're interested in any of those things, further details are available on the website. You can see the full reports there. Thanks very much. So our next board meeting is actually at the end of November, so I'll be back a bit sooner than normal with the update from that meeting. Thanks a lot.